Preventative care is the dental care that is directed to keeping people healthy. So often people think of dentistry as reparative care, which is fillings and identifying problems and fixing them. And while that is important, we really like to emphasize prevention because it's possible to avoid all those problems in the beginning. Cavities and periodontal disease can be prevented. There are some cases where there are systemic health problems that contribute to these things, but in general, if people know the little things that they can do to stay healthy, then we can keep them healthy.
Gum disease doesn't hurt. Toothaches don't always hurt, so without regular checkups and x-rays and fluoride treatments, you won't know that if something is going on until it's abscessed or you're in pain.
The frequency that people should come to the dentist is determined in a discussion that we have with the patient. It's not the same for everybody. Not everybody has to come twice a year. Some people can come once a year. Some people have to come 4 times a year. It depends on what your risk factors are for the various diseases we're treating. Periodontal disease, cavities, even crowding in young people will change the frequency that we want to see people so we can keep an eye on them and make sure we keep them healthy.
Growing up, I was always told that, having false teeth was about as inevitable as like death or taxes, and I find that coming here it is absolutely not the case. With good preventative care that I've received from Dr. Holt and his staff, I have my teeth and I enjoy coming to the dentist.
People have concerns about health risks from some of the materials that we use in dentistry. Fluoride, filling materials, even x-ray exposure, and those are all legitimate risks. And I take the time to explain those to patients to make sure they understand the risks and benefits of the materials and they understand their needs and their health needs.
Fluoride is really important, especially in children, because it helps remineralize the teeth and it helps protect them against decay. Sealants are just a thin plastic coating that we put into the grooves of the teeth to help protect the teeth from getting cavities, and a good preventative measure to help make sure that they don't have to keep coming in and having fillings done.
We always discuss with patients what options they have for materials. You can do ceramic fillings, gold fillings, white plastic fillings, silver fillings. And they all have their pros and cons. And so we take the time to make sure that we always discuss with patients what their options are and make sure that they can make an informed choice for what they want to use.
I think it's important to floss and brush because if you don't, then your teeth will fall out and you'll look like a grandma or grandpa.